Hello everyone. In this video, we will be talking about patient 4 in elderly, age over 65 and above. Fall is the most common patient safety incident that occurs in hospitals and care homes, which leads to serious injuries such as fractures, brain injuries, psychological trauma, and even death. Statistics shows that 3 million elderly patients are being admitted into A&E yearly due to fall. And this is about 30 to 40% of patients being admitted in the hospital. So, what is fall? Fall is when a patient unexpectedly ended up on the floor or lower ground, not because of illness, fainting. So, why are elderly patients being high risk of fall? There are so many factors that can lead the elderly patients to be falling. Number one factor, medications. It could be side effects of medications that they are taking, drowsiness, some antipsychosis or antidepressant medications also causes fall in elderly. 2. It could be medical issues such as Parkinson's or dementia. It could be weakness in the muscles, unsteady feet. It could be lack of vitamin D in their body. High impairment or high problems can cause fall in elderly. Or hazards. So, how can we prevent fall in elderly patients? Number one, I said before that medications due to side effects. So when they notice that they are feeling dizzy after taking their medications, they need to go to the GP or their doctor for a checkup. It could be that the medication needs to be reduced or the medication needs to be changed. Some medication are just being taken for a short period of time and they don't need to be taken anymore, which needs to be stopped or discarded. Also, some medications can lower your blood pressure. When you go to the GP and when they review your medication, the GP will be able to change or do the needful with your medications. Number 2, vision impairment. This could be as a result of poor visions, or you need a new glasses. So you need to do eye test as well from the opticians yearly. They will check your eyes and probably prescribe you a new pair of glasses or do a surgery like cataracts, which helps the elderly to be able to see clearer. Number 3, could be lack of vitamin D because patients doesn't go out and they are not taking enough sun in their body. So doctor will be able to prescribe them or recommend them vitamin D that they can take either from the counter or a prescribed one. It could be environmental hazards such as cables all over the floor, carpets not being fitted very well, lots of objects small spaces in the house. So with this, you will need cables to be taken away, rooms to be free from any objects, and more space, enough room for them to be able to walk around. They might need handrails for them to be able to grab on when they go into the shower. This helps them to get their feet, their balance when showering or when climbing the stairs or when going for a bathroom or toilet. Exercise. Exercise is very, very important because it strengthens their muscles and it helps them to get that balance better. Physiotherapies will do checkups on them and will probably recommend them with mobility aids such as walking stick, Zimmer frame, or stroller. They will prescribe the needful equipment that they need in order for them to fall. Encouragement really goes a long way because, like I said earlier, psychological trauma, this is when patients fall all the time and they're being scared of falling again. Finally, general checkup from the GP. So the GP will check their blood pressure, both the lying and the standing blood pressure, because sometimes patients do have low blood pressure whenever they stand up. So when they do the low lying and standing blood pressure, the GP will be able to advise you better. That's it from me from today. Thank you all for watching, and I will see you next time in my next video. Bye for now.